Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni. Let's look at today's top headlines. NMC releases Teachers' Eligibility Qualifications and Medical Institution Regulations 2022. Comprehensively laying down of the fundamentals for standardizing recruitment of doctors towards their entry into medical academia, the National Medical Commission has released the Teachers' Eligibility Qualifications and Medical Institution Regulations 2022 in its recently issued Gazette. These TEC Regulations 2022, published via Gazette issued by the NMC's PG Medical Education Board, are enforceable from February 14th this year. Earlier, the NMC had released a draft of these regulations seeking feedback from various stakeholders and authorities. Now, after thorough deliberation, the TEC Regulations 2022 have been released for immediate implementation. According to the rules, appointment and promotion of faculty in various teaching specialties imparting graduate and postgraduate medical education in medical institutions falling within the purview of the National Medical Commission has to be in accordance with the minimum qualifications and experience prescribed in these regulations so as to maintain a standard of teaching in medical institutions. Hospitals cannot deny treatment on ground of anyone's place of residence, says High Court. Providing relief to a pregnant woman who had been denied treatment at JMHCH 16 Chandigarh because of her place of residence, the High Court of Punjab and Haryana recently clarified that the government hospital cannot deny treatment on the ground of anyone's place of residence. 402 seats vacant for Round 2 NEET PG Counselling MPDME. The Director of Medical Education has released a list of revised vacancies in private medical colleges MDMS course for Round 2 NEET PG Counselling. Total 402 vacant seats are there across 7 colleges. For Round 2 of the counselling process, candidates are requested to do a fresh choice filling and choice locking per the given schedule. They can do this on the portal by using their login ID and password. Both domicile and non-domicile candidates can do the choice filling and lock for Round 2. There is no limit for choice filling. Candidates should choose the college based on the fee structure. For more details, you can check medicaldialogues.in. Government doctors can now form startups, hold adjunct positions in firms. Medical professionals and doctors can now pursue entrepreneurial ventures by forming startup companies or by taking adjunct position in a firm, such as by becoming a non-executive director or scientific advisor. This provision is a part of a new policy pushed by the Indian Council of Medical Research, Department of Health Research, which was released on Thursday by the Union Health Ministry. As per the policy, the doctors will also be permitted to undertake inter-institutional and industry projects alone or through companies licensed technologies to business entities, leading to commercializations, revenue generation for service substances and also for societal benefit. PGI Chandigarh doctors see red after colleague slapped on patient Demise. A resident doctor working at Postgraduate Institute of Medical Education and Research Chandigarh became a punching bag to a grieving attendant after he was slapped by a lady on the demise of her mother. Responding to the incident, the Association of Resident Doctors of the prestigious institute has demanded strict implementation of the law against violence and attack on doctors by demanding strict implementation of security at the hospital. A junior resident doctor attached to PGI Chandigarh was slapped by an attendant after his attempts to resuscitate the patient failed and she passed away on Monday night. The resident doctor staged an agitation in front of the director's office on Tuesday and demanded the deployment of security staff and resident doctors. Cadila Healthcare is now Zydus Lifesciences. The Zydus Group announced its new brand identity with the listed entity of the group, Cadila Healthcare Limited, to be known as Zydus Lifesciences Limited. In the new logo, 2 hearts come together to enclose us at the core. The heart represents the company's inclusives. The teal and purple colors represent the pillars of science and care, while the dynamic teal expresses Zydus dynamism and stands for the company's commitment to science. The purposeful purple stands for dedication to care and nurturance. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.